to cephalosporins, we have 6th generation, and the generation is based on its spectrum of action. And now coming from first to 3rd generation, the activity against gram-positive organisms decreases and gram-negative organism increases. So the first generation like cefazolin is best used for surgical prophylaxis, as it gives better coverage against gram-positive skin commensals. Then we have 2nd generation drugs like cefuroxime, and this is used better for surgical prophylaxis in abdominal surgeries and also gynecological surgeries. In 3rd generation, we have drugs like cefotaxime, ceftriaxone, and we have ceftazidime and cefoperazone, which has anti-pseudomonas activity, which is not seen in the drugs before this. And the 3rd generation drugs are the drug of choice in typhoid, gonorrhea, and empirical treatment for meningitis. It is also active against E. coli, Klebsiella, and Providentia, which are gram-negative organisms. 4th generation, we have cefepime and cefeprom. This is active against extended spectrum beta-lactamase. So it is here in 4th generation and 5th generation, they are both against the resistant organisms. In 4th generation, for organisms producing beta-lactamase are susceptible to 4th generation drugs like cefepime and cefeprom. And in 5th generation, we have drugs like ceftrolin and cefdiprol, which is active against the organisms which are producing resistance by means of altering the penicillin binding protein, that is MRSA. And we have 6th generation drugs like cefidracol, which is used in resistant UTI and ventilator-associated pneumonia. Now coming to monobactam is active only against gram-negative, and the benefit of this drug is it can be used when the patient has allergy to penicillin, as it has cross-reactivity only with ceftazidime due to its similar structure. And next, carbapenems have wide spectrum of action, and it is used in Enterobacter, Acinetobacter, and extended spectrum beta-lactamase organisms. It also has anti-pseudomonas activity. Now coming to individual drugs, we have imipenem. Imipenem has a problem that it is easily metabolized by renal dihydropeptidase. So it is used along with cilastatin, which is an inhibitor of renal dihydropeptidase, therefore to increase its half-life. And imipenem has a specific side effect of increased incidence of seizure in patients who are prone for seizures. And we have drugs like doripenem and meropenem, and ertapenem has the longest half-life.